For the last 36 years, St. Mary Development has used housing as a foundation to improve quality of life. We do this in two ways. We provide affordable housing for low-income seniors and families, and we provide wraparound supportive services through service coordination, prevention, and community health work. We want to make sure that it's person-centered care. All of our service coordinators are making sure that we meet our people where they're at to address the needs to improve their quality of life.
They have no one to call on when they are having a bad day. They have no one to call on if they need transportation to a doctor's appointment and don't know how to make that happen. So they come to us and we assist them with getting transportation to the medical doctors, or sometimes just providing that listening ear.
What most people don't realize is by 2030, the number of older adults will outweigh children in the state of Ohio. As our seniors age, they're going to need a place to age appropriately. They may move into our communities at 62 with very little needs, still working, still independent. But as they age, we're still in the communities, empowering the residents, bringing in fraud protection and scam education to the residents, giving them the tools they need to stay independent. After they retire and quit working and start navigating Medicare, that's where we jump in again.
So the role of a service coordinator is to provide wraparound services to help our residents age in place. We provide holistic services to make sure that they are getting the services that they need, such as groceries, connecting them to insurance benefits, maybe even Social Security, maybe helping them find a doctor. We also bring in educational programs to help them continue to learn how to age in place and to how to do it independently.
It's offering grab bars before people need it, no step entries, wider hallway doorways, making sure that you have attention to detail so that it's hard surface flooring to prevent falls rather than carpet. Those extra steps from the beginning of design until the residents are in there meeting with service coordinators changes lives. We have families and seniors and veterans that move within our communities that think that this is their last stop. They're settling here because they had to get out of their old house or sell their home that they can no longer navigate. And what they find out is they come here and they thrive.
So some of the extra things that we provide on property is that we partner with Senior Resource Connection to bring in congregate meals. So they get a warm meal Monday, Wednesday, and Friday right here on campus.
So one of the common misconceptions is when people age that they go from independent living or owning their own home to assisted living as their needs increase and then ultimately into long-term care. Unfortunately, that's not the case. Many of our residents could never afford to live in assisted living. What happens is they age where they're at until ultimately they pass at home. That's our goal, is to make sure that there's layers of care. So as their needs progress, our service coordinators jump in to make sure that they've got home delivered meals or in-home care to help support them so that they can have a good quality of life and still live independently.
So it's important to serve our veterans because a lot of them come from homelessness. And the same thing, sometimes they don't have family. They don't know how to navigate the VA system, getting benefits that they don't even know that they're qualified for. So we have a service coordinator here on campus who helps them navigate that, who introduce new benefits that they have never even heard of before. So we're excited that we can give them things that they need. We can meet their needs and their financial needs. I love coaching my resident service coordinators. We have CHWs, we have prevention staff, we have a well-rounded team that provide awesome services.
I can identify directly with the veterans because I myself am a veteran. Helping veterans directly is a gratifying feeling, knowing their backgrounds, knowing a lot of them from the Vietnam era didn't have the assistance when they came back, and now they're actually getting the assistance they need and deserve. As a veteran myself, we are able to provide veterans direct assistance for them to live their lives in the healthiest manner possible.
I work at St. Mary because I love what I do. I love the residents. I love working behind the scenes and coaching my team to serve their residents in their buildings.
I've been with St. Mary Development for over 11 years, and I've realized that oftentimes many of the reasons people get evicted is of no fault of their own. All of us are one crisis away. That extra hand of support that our seniors and families can get from supportive services makes the difference between evicted and housed, healthy and not.
My name is Andrew De La Rosa, and I'm a United States Army veteran. I was involved in some crazy antics up in Phoenix. I left here from Ohio and got up there and got involved in a whole bunch of problems and mess, and I became a drug addict. Whatever it was I could do, I did. I was seeking death, basically. But it took me twice dying over there to realize that that wasn't the path I wanted to go. So I got on a bus from the hospital, just left the hospital, and went to the hospital asking for assistance for housing. And the counselor there just looked at me and says, "Hey, I'll help you, but I need you to go to the emergency room." As soon as I went to the emergency room, I died. They revived me. They sent me up to the 3rd floor, cut me open, put a pacemaker in me, and started healing. I haven't done drugs in over 4 years now, 3.5, 4 years. I'll be here 4 years in February. I've stayed away from alcohol for 7 years. And cigarettes, 2 years ago, I quit completely. I'm just very blessed and fortunate to be here at St. Mary's. My Medicaid, Medicare, they helped me put all that together. They helped me with my Social Security benefits. Got me to the right place, make the calls, and they've been there throughout the whole 4 years now. Going on 4 years. They've been there helping me. And we don't always say thank you, but if they're watching this program, thank you. You've helped me save my life. And I'm here because of them and because of St. Mary's. So